Today's Medication Monday is beta blockers. Beta blockers is a class of medication better known as beta-adrenergic antagonist. It's probably one of the most commonly used cardiac medications and one that you will likely see in any setting that you're working in. Beta blockers block beta. They inhibit norepinephrine and epinephrine from binding to beta receptors. Beta are the adrenergic receptors on the sympathetic side. We have beta 1 and beta 2. Beta 1 is specific to the heart. You have one heart. If you were to stimulate it, we're going to cause increased heart rate, increased blood pressure, increased contraction, and increased cardiac output. Beta 2 is specific to the lungs. You have two lungs. If you were to stimulate it, you're going to cause bronchodilation. So if you're using a beta blocker, you're going to inhibit all of those effects, which is going to cause decreased heart rate, decreased blood pressure, decreased contraction, decreased cardiac output, overall creating a decrease in myocardial oxygen demand, which is great for patients with angina, hypertension, heart failure, post-MI, and post-CABG. But they come with side effects, and those side effects are basically an exacerbated version of what they're supposed to do. It can cause bradycardia, AV heart block, orthostatic hypotension, bronchoconstriction because of beta 2, hypoglycemia. So if you're working with a patient on a beta blocker, you want to use RPE because it causes a flat heart rate response. If you have patients who are diabetic, you want to pay attention to their glucose readings. And if they have a history of lung disease, you want to pay attention to possible increased shortness of breath. So there you have it, today's Medication Monday, beta blockers.